CNA Fire Door Safety Protocol. Welcome to the quiz. Question 1. You are taking a resident's blood pressure. The cuff you are using is too small for the resident's arm. How will this affect the reading? Option A. The reading will be falsely high. A cuff that is too small requires more pressure to occlude the artery, leading to an overestimation of the blood pressure. Option B. The reading will be falsely low. Option C. It will have no significant effect on the accuracy of the reading. Option D. It will be difficult to hear the correct cough sounds. The answer is A. A too small cuff gives a falsely high reading. Option A is correct because a too small cuff gives a falsely high reading. Option B is the opposite. Option C is incorrect. Option D may occur, but the primary effect is false high. Question 2. A resident with a feeding tube is lying flat in bed. What is the primary risk associated with this position? Option A. The resident is at high risk for aspiration pneumonia if they vomit, regurgitate, or if the feeding backs up into the esophagus, as there is no gravity to help keep it down. Option B. The tube may become kinked or dislodged more easily. Option C. The resident may be uncomfortable and unable to sleep. Option D. The tube feeding could flow too quickly due to gravity, causing cramping or diarrhea. The answer is A. Lying flat increases aspiration risk. Option A is correct because lying flat increases aspiration risk. Option B is possible but not primary. Option C is comfort. Option D is possible but not primary. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. A resident who is a Jehovah's Witness is scheduled for surgery and has a note in their chart refusing blood transfusions. The family asks you to convince them to accept blood if needed during surgery. What should you do? Option A. Respect the resident's advance directive and religious beliefs. Refuse to discuss it with them and report the family's request to the nurse, as the resident's wishes must be honored. Option B. Talk to the resident about the importance of blood transfusions in saving lives. Option C. Tell the family you will try to convince them for the sake of their loved one's safety. Option D. Agree with the family that the resident is being unreasonable and suggest they speak to the doctor. The answer is A. You must honor the resident's advance directive. Option A is correct because you must honor the resident's advance directive. Option B is incorrect because trying to convince violates their rights. Option C is incorrect because trying to convince violates their rights. Option D is incorrect because agreeing with family is inappropriate. Question 4. You're assisting a resident to get dressed. They want to wear a brightly colored, mismatched outfit that does not go together. What should you do? Option A. Let them choose what they want to wear, respecting their right to make choices about their personal appearance and self-expression, even if it doesn't match. Option B. Tell them the outfit doesn't match and pick out something more coordinated for them. Option C. Go ask a family member what they prefer the resident to wear. Option D. Dress them in the facility's standard clothing to avoid this issue. The answer is A. Respecting resident choice and autonomy is paramount. Option A is correct because respecting resident choice and autonomy is paramount, even if the outfit is mismatched. Option B is incorrect because imposing your preference disregards their autonomy. Option C is incorrect because family may not know their preference. Option D is incorrect because facility clothing limits choice. Question 5. When providing denture care, what is the most important safety measure to take? Option A. Hold the dentures firmly over a sink filled with a few inches of water or lined with a soft towel to prevent breakage if they are accidentally dropped. Option B. Use very hot water to kill all germs and bacteria on the dentures. Option C. Brush them with a hard-bristled toothbrush and toothpaste to remove all debris. Option D. Soak them overnight in a plain cup of water, not in a labeled container. The answer is A. Preventing breakage is a key safety measure. Option A is correct because preventing breakage is a key safety measure. Option B is incorrect because hot water can warp dentures. Option C is incorrect because hard bristles can scratch. Option D is incorrect because soaking in a labeled container is important to avoid loss. Question 6. A resident with a diagnosis of COPD is receiving oxygen at 2 liters per minute by a nasal cannula. During lunch, they remove their cannula to eat. What is the best way to handle this? Option A. Gently remind them why they need the oxygen and assist them in putting it back on after the meal. If they consistently remove it to eat, report this to the nurse, as a different delivery method, like a cannula that can be worn while eating, might be possible. Option B. Increase the oxygen flow rate to 4 liters per minute for the 30 minutes it's off to make up for the loss. Option C. Scold them for removing it, explaining that they need the oxygen. Option D. Let them eat without it, as it's only for a short period, and they will be fine. The answer is A. Educating and seeking solutions is the best approach. Option A is correct because it educates and seeks a solution. Option B is incorrect because increasing flow without order is dangerous. Option C is incorrect because scolding is not therapeutic. Option D is incorrect because they need oxygen continuously. Great job! Don't forget to subscribe. Bye!